Welcome to the self-paced learning for our new ICU medical infusion and PCA pumps. If you are taking this training, it is because you are unable to attend a live session. We will first review the functionality of the pumps, and then you will have a chance to complete the scenarios using a workbook. If you have any additional questions after completing training, please reach out to your supervisor or unit educator. First, to get to this point, there was a system standardization around our drug library during Phase 1. Previously, each affiliate had their own drug library with our Alaris pumps. Now we are all going to be on a single drug library, which will be important to understand when reviewing the scenarios later. We are currently on Phase 2, where we will be going live with the ICU medical infusion pumps and PCAs at SMCS on September 20th. Phase 3 will occur in the future. This will be where we have Epic and infusion pump integration. First, let's talk about the ICU Medical Plum 360 infusion pumps. This pump is a volumetric device, meaning it pulls fluid through the device and does not rely on gravity. This means that there are no head height requirements like gravity devices, and no more hangers, and most importantly, no more Volutrals or rate verify when using this pump. The high alert medication chart and policies have been updated to reflect this change in practice. Additionally, this pump also allows for concurrent delivery, a new feature we do not currently have with Alaris. Concurrent delivery is a function that allows both channels A and B to run at the same time. This can be useful for specific clinical situations with specific medications, for example, a septic patient that needs continuous IV fluids and IV antibiotics with no concern for fluid overload. You must always check for compatibility prior to running any medications concurrently. However, there are certain medications that we would not want to use concurrent delivery for, like our high alert medications. Another great feature of this pump is the ability to back prime. You will get to practice this feature during the scenarios. We are now going to talk a little more about the ICU Medical MedNet software, also known as the drug library. In the MedNet software, there are still lower and upper hard and soft limits. Soft limits will give you a warning, which you should always read and ensure you are entering the correct information in the pump. Hard limits cannot be overridden. When you hit a hard limit, you will see 3 dashes. You must clear this field before being able to continue to program the pump. Please see the bottom left picture that illustrates this. For soft limits, you will see an up or down arrow displayed indicating that you are operating outside of the soft limit. Going back to the single drug library, since all affiliates are now using it, we had to standardize our clinical care areas, or CCAs. These were previously known as profiles in Alaris. If you are unsure of which CCA to use, please see your supervisor or consult with pharmacy. Since we are all using the single drug library, there will be some CCAs that we will never use at SMCS, for example, step down, psychiatry, PACE, or surgical hospital. Let's now review the Plum 360 hardware. This page gives you an overview of the front of the pump. Please note there are hard and soft keys you will be using while programming the pump. Please always read the screen as it prompts you through the programming. With the Plum 360 pumps, it is important that they remain plugged in. A typical battery operating time with a new and fully charged battery is 4 to 7 hours, depending on the rate. If the low battery alarm sounds, connect the device to AC power immediately. The battery charges whenever it is connected to AC power. If the infuser is switched off, recharge takes approximately 8 hours. Recharge takes longer if the infuser is on. Please note that if a depleted battery alarm occurs, the device will shut down in 3 minutes. If plugged in, the device will immediately reboot. In this slide, you can also see the components of the back of the pump. Now let's talk about tubing. What is going to be different? Again, no hanger is needed for secondary infusions. Bags or bottles can be placed at the same vertical height as a primary infusion. Mini poles attached to the side of the Plum 360 device can accommodate bags or bottles for infusion. This means that we no longer have to hang infusions at 20 inches above the pump. This is our primary set with the Plum 360 that most of you will use. You will get a chance to prime this set later on. This will be our main anesthesia set. Please note that the anesthesia set will have 2 lower clave Y ports and a distal roller clamp, in addition to a back check valve. We will also have microbore tubing. This will be the only primary set stocked in pediatric departments. Please note that if you use this set, the cassette does not come with a clave and you will need to add this on to the B port. This set will be for blood and blood product administration. ICU Medical also makes tubing sets with filters in line. They will have both a 1.2 and a 0.2 micron filter tubing set. One practice change we will now have, as the current guidelines have changed, is that TPN and lipids will now both be ran through a 1.2 micron filter. Please see the picture in the slide for a visual and note that TPN is on the primary tubing with the 1.2 micron filter, lipids are on the secondary tubing connected to the B port, and they are running concurrently. A syringe can be attached to the B port for delivery. This is only for slow IV push medications requiring at least 3 minutes administration time with the following guidelines. The syringe size must be between 3 mils to 60 mils. A minimum volume of 1.5 mils is required when using a syringe that is 12 mils or larger. And for a syringe 10 mils or smaller, you must attach an adapter. See the picture to the right. You also must always flush with 13 mils, which infuses at the same rate, to infuse all the medication in the distal tubing, ensuring the patient receives the medication. An exception to using the B port for syringe delivery is that our Alaris large volume pumps and syringe pumps will continue to be utilized in our NICU. In PICU, Alaris large volume pumps and syringe pumps will continue to be used on the cardiac surgery population, and all other populations will utilize the ICU Medical large volume pump and the Alaris syringe pump for any medications that are delivered from pharmacy in a syringe. We are also getting new IV poles and retrofitting existing IV poles with power strips. Please only plug IV pumps into these power strips and not other equipment such as SCDs.
Press in the cassette flow regulator to make sure it is closed and confirm that there is no flow during priming. Insert the piercing pin into the outlet on the fluid container using a twisting motion. Do not insert the piercing pin while the container is hanging above the infuser. Suspend the container on the IV pole. Squeeze to fill drip chamber to the score mark. Do not completely fill the drip chamber. If using a rigid fluid container such as a glass bottle, open the filter vent cover above the drip chamber. If using a flexible plastic container, make sure the vent cover is closed. Invert the cassette so the secondary port is pointing down. Slowly open the flow regulator by turning it counterclockwise while holding the cassette in the inverted position to allow the fluid to flow into the cassette at a controlled rate. Note, to quickly stop the flow at any time, push in on the flow regulator. When the first drop appears in the pumping chamber, turn the cassette upright. Continue to slowly prime the set until all air is removed from the cassette and the remainder of the tubing. Tap the cassette Y sites and tubing to dislodge air bubbles. Note, if the filter at the distal patient end of the tubing gets wet, you must temporarily remove the cap to continue priming. Once the priming is complete, push in the flow regulator to close. Confirm there is no flow. Check the drip chamber and the distal end of the tubing to confirm that there is no flow and that no kinks appear in the tubing. If you observe flow or leaks, close all clamps and replace the administration set. Lift the lever to open the cassette door. Grasp the cassette by the finger grip. Slide the cassette between the cassette door and the door guides. Note, do not force the door closed. Make sure the cassette is fully inserted into the door guides. Press the lever down to close the cassette door. For Plum 360, insert the proximal line into the Line A tubing guide.
You will now have time to work on the self-paced scenarios in your book. This should take you about 45 to 60 minutes. Please complete pages 1 through 9 and move on to the PCA module if appropriate for your department when finished.